Welcome to Section 7, Family Outreach and Consumer Education for Child Care Services section. My name is Chris Woodring. I'm a Senior Tribal Technical Assistant Specialist with the Tribal Child Care Capacity Building Center. Today we will be sharing information with you on Section 7. Joining me today is my colleague Melissa. Melissa, would you care to say hello?
Hello, my name is Melissa Madrid and I'm the Deputy Project Director for the Tribal Child Care Capacity Building Center. Thank you, Chris.
Our objectives for today are to help tribal lead agencies understand the requirements and flexibilities for family outreach and consumer education, including sharing information with families, providers, and the general public, the information on developmental screenings for children, consumer and provider education, information on monitoring and enforcement of providers, the parental complaint process, and to build awareness of the implementation status for CCDF consumer education requirements. Also, to understand what sufficient responses are for Section 7, including the components needed to certify. Consumer education is crucial in supporting families as they navigate child care options. Consumer education also ensures parents and caregivers access clear, reliable information about child care services, including the health and safety requirements, the licensing standards, and available resources. This helps families make informed choices that best meet their needs. By providing transparent information on child care services, the policies, the quality standards, these efforts empower families to make choices that promote their children's well-being and development. Ultimately, sharing information with families strengthens families' access to safe, high-quality childcare. Consumer education requirements for sharing about providers and families. There are 8 components listed on the screen that a tribal lead agency would have in place. Tribal lead agencies, however, have the flexibility in how this information is shared. Some examples we've heard from tribal lead agencies are hard copies or electronically. However, these pieces must always be shared with families by the tribal lead agency. Tribal lead agencies must also share information on developmental screenings to families. And beyond providing families with information on child care providers, tribal lead agencies play a critical role in ensuring families and providers receive essential information on the developmental screenings. Tribal lead agencies are required to share information on developmental screenings with families and providers through a method of their choice. The following is required. Provide information on how families can access developmental screenings. Ensure that CCDF providers are informed about available resources and services. These are related to the early and periodic screening, diagnosis, and treatment program, commonly referred to as EPSDT, services under the Individuals with Disabilities Education Act, IDEA programs as applicable, such as Head Start, state, or tribal pre-K. The availability of financial assistance for child care services. This ensures that families, providers, and communities have the necessary resources to support children's development effectively. I shall now pass it over to my colleague, Melissa.
Thank you, Chris. Now let's take a closer look at the broader requirements for sharing information with families, providers, and the general public. There are 6 requirements for sharing information with families, providers, and the general public. We'll break down each requirement in the next series of the slides. Tribal lead agencies do have flexibility in how they deliver the information. Let's turn our attention to sharing information about child care services, information, and availability. Collecting and sharing information is vital for families, providers, and again, the general public in supporting early childhood development. This information can be helpful for families to make informed choices and to help the public understand what programs and services are available to them. Tribal lead agencies are required to share all of the following information and have the flexibility through a method of their choice to do so. the availability of childcare services, the full range of category of care provided through the tribal CCDF program, other programs that are available in the service area for which the family may be eligible as applicable, such as Head Start, state, or tribal pre-K, and the availability of financial assistance to obtain childcare services. And this will be for Plan Question 7.3.1. As we continue our discussion, we will examine additional information that the tribal lead agency is required for childcare assistance, often quality for additional supports. Therefore, this information can assist families in identifying other financial benefits and services that support their pursuit of economic stability. As a general reminder, not all programs listed may be available in your tribal service area. And again, this is for tribal CCDF Plan Question 7.3.2. Another way we support families in providing information is by making sure parents are aware that they may be eligible for TANF. Tribal lead agencies also need to make sure that parents who receive temporary assistance for needy families, also referred to as TANF benefits, are aware of their benefits when it comes to childcare and work requirements. If a single custodial parent has demonstrated inability to find appropriate childcare for a child under 6, they may qualify for an exemption to TANF work requirements. Sharing this information helps prevent parents from being penalized when they face real challenges in securing childcare. It also supports family stability and economic security by ensuring parents aren't forced to choose between meeting their work requirements and caring for their young children. By making sure this information reaches families, tribal lead agencies help promote transparency and empower parents to make informed decisions, helping them understand their options and avoid unnecessary penalties when childcare isn't available. Tribal lead agencies will share this information regardless if the tribe offers the TANF program by giving families the state TANF program information related to work requirements. And again, this is Tribal Plan Question 7.3.3. Beyond childcare assistance, tribal lead agencies play a vital role in equipping families with knowledge that strengthens their overall well-being. Families are not just seeking childcare, they are nurturing, teaching, and guiding their children every day. That's why sharing research on child development and best practices is just as important as sharing information about the childcare options. Tribal lead agencies are required to give families and providers resources on each of the following: physical health and development, healthy eating and physical activities, and meaningful parent and family engagement. And by doing so, you will help ensure that children have the foundation they need to grow and thrive. When parents understand developmental milestones, they can better support their children's learning. When providers incorporate best practices into their programs, they create a richer environment that fosters growth. And when families and caregivers work together, children benefit from strong supportive relationships that set them up for lifelong success. This is not something that tribal lead agencies do alone. It's a collaborative effort that ensures family providers and communities have access to current research and effective strategies. By making this information widely available and accessible, we are empowering parents and caregivers to make informed choices that contribute to the overall health, education, and well-being of Native children. In doing so, we are not only supporting individual families, but strengthening our communities for generations to come. This is for Tribal CCDF Plan Question 7.3.4. While access to child development information does lay the foundation for a child's growth, it's just one piece of the puzzle. A child's overall well-being also depends on their social, emotional behavior, and mental health. These factors play a crucial role in helping children build relationships, manage emotions, and thrive in early childhood development environments. Ensuring families have access to child development information is just one piece of a larger effort to support children's overall well-being. Equally important is making sure families, providers, and communities have the resources they need on social, emotional, behavioral, and mental health. Key factors in helping children build relationships, manage emotions, and navigate challenges in early learning environments. To support this, tribal lead agencies share information on positive behavioral health interventions and will support and provide supports that are appropriate for young children. Partnership with organizations specializing in early childhood mental health also help ensure that families have access to culturally responsive resources when those behavioral challenges arrive. At the same point, we recognize that suspension and expulsion in early childhood settings can have a long-term negative effect on children and their families. That's why tribal lead agencies establish policies that prevent suspension and expulsion from children birth to age 5 in childcare and other childhood programs receiving CCDF funds. Instead of removing children from care programs, you can use inclusive strategies, early intervention, and positive behavioral supports to help children succeed in their learning environment. By sharing the safe information, tribal lead agencies equip families and providers with the tools to foster emotional resilience and well-being in young children. This strengthens families, it does support early learning programs, and helps ensure that all children have the opportunity to grow and thrive in safe, nurturing environments. This is for Tribal CCDF Plan questions 7.3.5 and 7.3.6. I'm going to go ahead and turn it over to Chris.
Now that we've gone through the 6 key requirements for sharing information, the next step is ensuring that this information is not only available, but also easy for families, providers, and the public to find and understand. For tribal lead agencies using state licensed providers or license exempt providers, the state is already satisfying this requirement. Tribal lead agencies would need to know how to access the information to provide to families. This might require coordination with the state. For tribal lead agencies who have only tribally operated centers, they would not need to collect information on child care providers outside of their tribally operated center. This slide lists the components a tribal lead agency will need in place. Consumer education information is consumer friendly and easily accessible. Although there is no federal CCDF definition for easily accessible, tribal lead agencies may consider easily accessible information to be simple to obtain, written in plain language, and easy to understand. Additionally, sharing policies and procedures related to comprehensive background check processes for providers and child care staff and include offenses that prevent individuals from becoming a provider. Sharing a localized list that includes all licensed child care providers and differentiation between licensed and license exempt providers and is searchable by zip code. Relative providers are not required to be included. Additionally, sharing information about the quality of each child care provider in the service area and sharing information about the referral process to Child Care Resource and Referral, commonly referred to as CCR&R agencies if applicable. This relates to Tribal CCDF Plan Section 7.4. So what is consumer-friendly and easily accessible information? Consumer-friendly and accessible information refers to information presented in a clear, straightforward manner that is easy for anyone to understand and use, particularly considering the needs of the community. A breakdown on how information can possibly be shared to the 3 different audiences. For families, it could be verbally through a newsletter or a website. To providers, it could be formal communication, such as classes or training. The general public could be brochures or newsletters. We shall now shift gears to share the information that must be included on monitoring and enforcement. Tribal lead agency needs to provide information to families, the general public, and when applicable, child care providers through a consumer-friendly and easily accessible method of their choice. The monitoring and inspection reports for providers, the aggregate data on deaths, serious injuries, and the number of substantiated cases of child abuse that have occurred in a child care setting. The monitoring and inspection requirements for providers are referenced in section 2.7, the monitoring and enforcement of health and safety requirements. Tribal lead agencies have the flexibility to share this information through a method of their choice. This relates to Plan Question 7.5.1. Within the monitoring and inspection reports about providers, tribal lead agencies must include the following 7 required elements in plain language and in a timely manner. Results of required annual monitoring visits and visits due to a major substantiated complaint about a provider's failure to comply with health and safety requirements and child care policies. Information on the date of such inspection. Areas of compliance and non-compliance. Information on corrective actions taken by the tribal lead agency and child care provider when applicable. Any health and safety violations, including any fatalities and serious injuries occurring at the provider, prominently displayed on the report or summary. A minimum of 3 years documentation where available. A tribal lead agency must also establish a process for correcting inaccuracies that might be found in inspection reports. Ensuring transparency goes beyond just making the monitoring reports available. It also involves clearly communicating the requirements for how providers are monitored. Tribal lead agencies are obligated to share the information with families, providers, and the general public about how child care providers are monitored and inspected and by whom. Monitoring and inspection reports that are in plain language and meets the 7 required elements. I shall now pass it over to my colleague, Melissa.
Thank you, Chris. In addition to providing detailed monitoring and inspection reports and information about the requirement for monitoring and inspections, tribal lead agencies must share annual aggregate data with families, providers, and the general public. This ensures transparency while protecting individuals' privacy. The tribal lead agency must share aggregate information for each provider category and licensing status, aggregate data on number of deaths, number of serious injuries, and total number of children in care. In addition, the tribal lead agency must also share aggregate data on substantiated cases of child abuse that have occurred in child care settings. Please note the plan reference an aggregated data report, but a report is not required. Lead agencies have flexibility in how they provide the data. The report of aggregate data is limited to sharing the data itself and does not need to include a narrative of discussion. This is for Plan Question 7.5.3. Providing families with clear and accessible consumer education is just one part of ensuring transparency in child care services. Another critical component is giving parents a way to voice concerns when issues arise. Tribal lead agencies must have a process in place for parents to submit a complaint about child care providers, as well as a system for screening, substantiating, and responding to those complaints. Additionally, information about substantiated complaints must be made available to the public upon request. This shows exemption from the plan, showing the 4-part question that covers screening, substantiating, responding, and monitoring. This is for Tribal Plan Question 7.6.2. Providing families with clear and accessible consumer education is just one part of ensuring transparency in child care services. Another critical component is giving parents a way to voice concerns when those issues arise. Tribal lead agencies must have a process in place for parents to submit the complaints about child care providers, as well again as a system for screening, substantiating, and responding to those complaints. The process is a method of choice that aligns with tribal nations' needs and goals. Additionally, information about substantiated complaints must be made available to the public upon request. The requirements for reporting, responding, and maintaining records of parental complaints are displayed on the screen. And now I'm going to turn it back over to Chris.
Thank you, Melissa. Here are a few examples of processes for parents to submit a complaint to the tribal lead agency about child care providers. This may look different according to your community. Tribal lead agencies have the flexibility on how this reporting process takes place. Some examples include, but are not limited to, the following: an operated phone line, a voicemail box, a web-based form, or an email address. This question relates to Plan Section 7.6.1. We have reviewed the required components of what tribal aid agencies must share about child care providers. Let's talk about the flexibilities a tribal aid agency has in determining the best methods for distributing this information, which can be through printed materials, electronic formats, or another method. The tribal aid agency has the flexibility to decide how to share this information in a way that best serves its community. This may look different across programs, depending on local needs and resources. Some tribal aid agencies also use a state consumer education website for relevant pieces, especially when working with state regulated providers. As part of ensuring consumer education is accessible, tribal aid agencies must also share contact information with families, providers, and the general public. This includes details on how families can reach the tribal aid agency, its designee, or other programs that can help them understand the consumer information. Providing clear points of contact ensures families have the support they need to navigate childcare options and policies. This refers to Plan Question 7.6.5. What additional information do you need in order to fill out Section 7 of the plan related to sharing information with families, information on developmental screenings, consumer and provider education, information on monitoring and enforcement, or the parental complaint process? What partners might you need to connect with about this section? And what questions or topics would be helpful for you to discuss with the Office of Child Care? Lastly, I'd like to share how to connect with us. If you are not already, please do so. Subscribe to the Office of Child Care announcements to receive all of the latest information. Also, feel free to email us at occtribal@acf.hhs.gov if you would like to connect directly. We thank you for taking the time to review this information and let us know if we can be of further assistance.